Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Let me introduce myself. My name is Firdaus with my friend Andreas Ragil Putra, Anif Mujidah, and Eli Dwi Masito. In here, I would like to explain about our research with title The Effectiveness of Combination of Clapping and Common Cold Message Therapy on Breathing Frequency and Number of Staphylococcus bacteria in toddlers with upper respiratory tract infection ARI. One of the symptoms of the common cold is a cough and runny nose that easily attacks both children and adults. In children, complaints of sneezing, coughing, and runny nose are common at the age under 6 years. Each child experiences an average of 6 to 8 times each year. Alsace research explained the effect of baby message on respiratory function but has not yet been explained. Its physical function are frequency, breath, and bacterial decline. Given the importance of lung function in life, especially for children, because of the many secrets that accumulate and colonize and cause an increase in bacteria, a quick and precise technique is needed, namely a combination of clapping and message. Therefore, the aim of this study is the effectiveness of the combination of clapping therapy and common cold message on respiratory frequency and the number of staphylococcus in toddlers with upper respiratory tract infection ARI. The study used a quasi-experimental design with pre-test and post-test. The population in the study were all pediatric patients with cough and cold complaints who did message therapy. The criteria for inclusion of health workers working in health service that accept COVID patients. This research used instruments and procedures. Collecting data in this study, the questionnaire contains demographic data, age, gender, nutritional status, house density, and immunization. The observation sheet contains the value of the respiratory rate and the results of the number of staphylococcal bacteria using laboratory types. For the data analysis was carried out by analytical using Wilcoxon sign ring to analyze the effect of cold message therapy with a combination of clapping, and to analyze the effect of message therapy on the results of respiratory frequency and the number of staphylococcal bacteria. The result from the study from test result Wilcoxon statistical in the control group obtained a p-value. It is 0.046, which means that there is no effect of message therapy on Staphylococcus bacteria, while the intervention group has a p-value of zero point 0.0, which means p-value less than 0.05. It can be concluded that there is an effect of clapping and message therapy on respiratory rate. Pediatric message therapy is proven to be very effective for children who suffer from asthma, cough and cold, constipation, and abdominal colic or arthritis, and premature babies. A massage is a form of touch therapy that serves as an important treatment technique. Acute respiratory infections are caused by air pollution, which is transmitted through saliva and sneezing, so that respiratory air containing germs or microorganisms is inhaled by healthy people whose respiratory tract infects and cause inflammation. And in this research is interesting research conducted because its combination of clamping and common cold message therapy will have a major effect on breathing frequency and the number of Staphylococcus bacteria in toddlers with upper respiratory tract infection. Ladies and gentlemen, I think that's enough from me for my presentation about my research. I hope this research can be useful in the future. I think that's all. Wassalamualaikum warahmatullahi wabarakatuh.